I'm 34 years old. I live here in San Antonio, and I was diagnosed with breast cancer almost 4 years ago. My husband and I have 4 children together, and our youngest was just a little over a year old, and we decided to go in hopes for another boy, to have another baby. And I went to give him a hug and a kiss one night, December 20th, 2007, and I felt a lump. I felt something that kind of hurt a little bit. So I kind of felt around, and then of course I had my husband feel around, and then I started freaking out. He was like, everything's going to be fine, you're too young, everything's fine, don't worry, you worry about everything, and that's just kind of how it is. And then I couldn't get it out of my mind. I knew something was not right. I'm one of those people that I go with my gut instinct, and I just knew. And so I called my doctors, my OBGYN, and he was laughing because he thought it was going to be, okay, you're pregnant, come back in. And I said, no, something's going on, And so he said, yeah, just come in, it's kind of slow. And so I went in, and I already knew. I said, just cut them off. I don't want my breasts anymore, just cut them off. I'm 30 years old at that time, wanting another child, and thinking I'm invincible, and just deal with it, move on, and let's go. And so he said, oh, it's probably nothing. You're 30 years old, you just had a baby, you're too young. I didn't have any history of cancer at all in my family. So it would just be weird. I was perfectly healthy. And then I went in, and he felt around and was joking with my husband. He's like, everything's fine. And then he found the lump, and his face and his demeanor just totally changed. He said, you're 30, so you're probably fine, but let's go ahead and get a mammogram done. So I said, okay. It wasn't urgent, really, until I saw his face again and said, we're doing it today. So I got in that same day to get my mammogram done. And at that point, I was really scared. My husband was like, everything's fine, everything's going to be okay. And as soon as I had my mammogram, I had to go for an ultrasound right away. And the radiologist came in, and after he read it, and he said, we're going to send this back to your OBGYN, and you'll probably hear from him in a couple days. And it was the next day that he said, we have an appointment scheduled for you for a biopsy. Just like that. And so that holiday season was totally ruined for me, because it happened in between Christmas and New Year's that I started going through everything. The official diagnosis came January 7th of that year, and although I was ready for it and I was expecting it, you don't know what that feels like until you hear those words. So that was the day I was diagnosed, and I immediately saw a breast surgeon and then a plastic surgeon right back to back. And so, still reeling from the news, I remember telling him, just take them off, do whatever, I really don't care. I'm only 30 years old, I've got 4 kids, do what you gotta do, I need to move on. Thinking that it was just something little. And so he said, the plastic surgeon said, sure, we can do what all women do, and we'll just do the tissue expanders. We'll expand you during chemo and radiation, because at that point we had already found out that I would need that. And then we'll switch them out and put the implants in, told me what size all the women go through, and that was it. I said, okay, well those are my options. They said, yeah, you look better, you look fabulous, everything will be fine. So, I went through that process. I went through the mastectomy and the tissue expanders, and I started chemo, and Valentine's Day of 2008, my husband and I had a date in the chemo chair, and then, went through all of that and finished chemo, and then did the radiation, getting, expanded all during chemo. And, it was painful, but I didn't know if it was from the mastectomy or from the chemo or from really what it was. So we finished that, went through the radiation. About 6 weeks after that, they said, oh, we can go ahead and do the exchange, the implant exchange, but we ended up waiting until December. So it had been almost a year from the time that I had found a lump to the time that I would have my implants put in. So I was like, okay, this is progress, I'll have them put in and I'll be done and I'll move on. Everything would be great. And I remember, you know, I had a lot of pain from the expanders, and they said, oh, that's normal because they're heavy and their expanders are not meant to, you know, feel like a normal breast. They're just to expand your skin out. And so I took that answer. And then after I had the implant exchange, I woke up and I was still in pain, and I really couldn't figure out why. They said it was, you just had surgery, everything will be fine. So I accepted that. And I moved on, you know, I tried to move on, and I kept, you know, waking up every morning, going to work, raising my kids, being a wife. But I was always not feeling really well and had a lot of pain. Ended up going to a physical therapist and tried that. Tried, you know, stretching, which is good for anybody that goes through, you know, the surgeries that we've gone through as breast cancer patients. And that relieved a little bit, but not a lot. It got to the point where my arm was going numb because although I had the bilateral mastectomy and I had the implants put in and the radiation only on the right side, the damage from the radiation had moved the implant going up to underneath my arm. And, you know, we had gone back to my plastic surgeon and had said, you know, this really isn't working cosmetically, it doesn't look good, but more importantly, it hurts. Is there anything that we can do? And it's like, no, you know, this is what we had to work with, you know, basically. I felt insulted as a human, but I was pissed. After everything I had been through, you know, can I just, you know, have somebody kind of just say, you know what, I understand that pain, you know, can happen, but let's see what we can do to fix it. And that just wasn't what I was getting. And so I was getting depressed because, you know, to wake up every day, having gone through what I've gone through, and knowing that I was going to fight for everything, I wanted to be normal. I wanted to just live my life and not be in pain, not come home from work and just want to sit there because, you know, you don't feel well. And so I was actually complaining to my mom and saying, you know, I hate this, you know, I just want them out. I just really want my implants out. I don't even care if I don't have a chest anymore. And I talked about the whole thing with my husband and my mom, and they said, well, you know, you have 3 girls, and so you really might want to think about body image. You know, you can do it. You can do that and still be able to tell your girls it's okay to, you know, be however you look. But the more and more I thought about it, as much trauma as my kids had gone through my diagnosis and treatments and surgeries, I didn't want them to maybe feel embarrassed, you know, as they got older trying to explain what happened to Mom. Because they do. I mean, they talk about it, but, you know, it would be, for my oldest, who's 15 now, you know, it would be awkward for her. And so we went ahead and said, well, let's see if there's anything else out there. My mom remembered that she had worked with a doctor when they were both in the military. Said, I think he's retired, and I think I know where he works. And that's how I found PRMA. And that day, when we had the appointment to come in, my husband was with me. I was shaking like a leaf. I couldn't sleep the night before. I just knew there was nothing anybody could do. Because if there was something, I had trusted my surgeons to be able to provide that information to me. Because I really did like him. I mean, he was a very nice man. But and I thought I knew what was going on. You know, I thought I knew what there was. And after doing a little bit of research about PRMA before I got here and what they did do, I was excited, but I was so nervous that there wasn't going to be anything they could do to help me. And so I met with Dr. Ishida and Heather, 2 of my most favorite people in the world. And, you know, Dr. Ishida's demeanor, you know, he was looking at everything and very quiet. I'm sitting there like about ready to fall off my chair. He was like, well, I think we can help you. And at that moment, it was just relief. I was just so excited. And I said, you know, just take them out. I really just want you to take my implants out. He said, no, we can do everything. We can do the DIEP, the Dyke Flap procedure. And so he talked about it, and I found out it was like a 10-hour surgery, and I was like, okay, you know, exciting, but that's a long surgery, you know, and I didn't hesitate to say yes, just schedule me as soon as I can, because I needed the implants out, and I needed to be normal, and I knew that this was my last shot at being normal for the rest of my life, since I planned to live for a very long time. So It was scheduled for December, which is ironic because everything for me apparently had happened in December. So it was 2010, December, so almost 3 years to the date of diagnosis, but it was December 16th is when I had the surgery, so it was almost exactly 3 years to the day I found the lump. And I had that procedure, and it was a long surgery, and I remember waking up in the recovery room and just saying, oh, praise God, I'm alive, you know. And then the other thought was, I'm not in pain. As big of a surgery that I had had, there was discomfort, but that pain that I had had in my arm was gone immediately. And afterwards he came talking to me, he said, well, we did this and we did that. I said, I really don't care. I said, I feel so much better. So I had the surgery at Methodist and stayed there for 4 days, and everybody was wonderful. The staff at the hospital, they said, we work with PRMA all the time, those are our most favorite people too. And I said, well, you know, I'm beginning to see this, you know, this trend here. So not only did my life change from the diagnosis in a way that was not good, it has taught me a lot. And then my life changed again when I found PRMA, because they gave me back what had been taken from me. No, we probably won't ever have our 5th child, kind of done, but I know I'm as normal as I'm going to be, which, you know, some people might question sometimes, but I know I feel well. I know I feel more feminine. I like what I see now. It doesn't, yes, I had cancer. Yes, that's something I'll never forget in my life. But you don't see it automatically anymore. Granted, I don't walk around topless, but I feel like a woman, you know, and I'm not embarrassed to be with my husband. I'm not embarrassed if my kids walk in, you know. I'm just totally 100% me, in no pain, and feeling good. So I had the stage 1 and I had the stage 2, and I'm going to be having the stage 3 in about 3 months. So I will be almost done. And I just can't wait to... I tell everybody about this facility, even people from all over the country, because I do go to different websites that have support, and I just tell them, you know, what greatness that it has done for me, and it has restored me in a way I didn't think was possible.